Hi, I'm Dr. Nabila Zambrano. I'm an OB/GYN and have practiced with Community Physician Network since 2017. In terms of taking care of a patient, I think it has to be a mutual relationship in terms that I give recommendations, but they also tell me what they're comfortable in terms of their care, either medication-wise or they're looking for surgery. I want that feedback from them, but I also want to be able to advise them on what seems like the safest choice, the least invasive choice. I want to be able for them to feel comfortable calling me if they don't feel comfortable taking a medication or if they have some questions after their visit. I know it's very often they come to a visit, they get bombarded with information and leave kind of confused. So I always like at the end of my visit to say, there's my chart available, or you can email me. I can respond anytime because I'm often checking my inbox even if I'm out of the office. There's our triage nurses, which are awesome, respond right away, or you can always just make a follow-up appointment. But I want to make sure that there's always that relationship where I can give them information and give them my opinion of what would work best, but they can also tell me what's working for them. In terms of my interest specific to OB/GYN, definitely would have to be laparoscopic surgery and long-acting contraception. So that would be the next button-on insertions, IUD insertions, and then for laparoscopic surgery, trying to do the least invasive surgeries, either big surgeries like hysterectomies or minor surgeries like tubal ligations or cystectomies. In terms of what I do when I'm not at work, I love just spending time with my fiance's family or him, either going around downtown where we live for restaurants or just going out to the movies, doing the most relaxing and adult things ever, just because we don't get that downtime when we're working. Because when I'm off work, I like doing things that don't have anything to do with medicine, just to take a little piece of my brain away from that. I think the most important thing in terms of referring physicians or patients for me is that I'm bilingual, so that's a nice way for patients to feel comfortable that are Spanish speaking only, or that usually have to bring family members to help translate. I feel like it's a better communication, and for the patient comfort, it puts them a little bit more at ease.